a lot of people were in lockdown without the need to be, right?
Well, that and even worse, because when we lock down the schools and when we lock down young, healthy people, they're the key to herd immunity. So if children had just been let free, children have almost no ACE2 receptors in their upper airway, so they can barely get sick at all with COVID. But what they can do is they can encounter it, develop immunity to it without getting sick. And that's what creates herd immunity. And then the virus can no longer spread when enough people are immune. So by locking down society, they actually gave the virus a much better chance to infect the population. And it made people who were vulnerable, that should have maybe been isolated voluntarily, it made them vulnerable because herd immunity wasn't happening as it would have happened naturally.
Dr. Trosi, I have also learned that you were one of those Canadian doctors that got your license suspended. Why was that?
Well, because I spoke the truth, because I maintained the Hippocratic Oath. So we're in a very unusual situation where, and this is similar other places, although Canada is particularly bad, where the medical regulators who are supposed to ensure that medical ethics are followed, who are supposed to ensure that doctors are following good science, they are now the enforcers of this, WHO manipulated agenda. So they warned doctors in Canada. They said, don't provide anyone with an exemption for this supposed vaccine. Don't provide, they called it unproven treatments like hydroxychloroquine or ivermectin. Don't say anything. They literally don't say anything that contradicts public health. So doctors basically were told, if you're going to keep your license in your province, you're going to say this is safe and effective. Well, there's no way I was going to do that. And I'm not the only one. Like so many doctors and nurses have lost their licenses, and we are the cream of the crop who will, be the leaders after we pull out of this thing.